So this is Chapter 21, Managing Patient Care. So managing patient care is a really big topic right now because of the overcrowding of hospitals due to the pandemic. So the National Council for State Boards of Nursing identified competencies that registered nurses and licensed practical nurses and licensed vocational nurses need on entry to practice. If you look at box 21.1, entry-level nursing competencies with students, which you will find on page 280, they talk about managed care of patients as one of those entry-level nurse competencies. So being able to manage the care of your patients is an important competency for you as an entry-level nurse. Regardless of the type of setting in which you eventually choose to work as a staff nurse, you'll be responsible for using organizational resources, participating in organizational routines while providing direct care to patients, using time productively, collaborating with all members of the healthcare team, and using certain leadership characteristics to manage others on the nursing team. As an RN, you're not only responsible for yourself, but you're responsible for all the members of the team that are underneath of you, LPNs, LVNs, care techs, CNAs, MAs, anybody who's underneath of you. You have to be able to organize and manage the care of patients that they are doing, as well as your own care. So it's very important that you understand management of care. So, building a nursing team. A strong nursing team works together to achieve the best outcomes for their patients. As a nurse, it's also important to work as an empowering environment as a member of a solid and strong nursing team. Now, as the RN, you will often be the leader of that team, or you may be working under a charge nurse or a nursing unit manager, but you're going to be a leader of many staff members. So it's important for you to understand leadership and be an effective role model for those staff members. Effective team development requires team building and training, trust, and communication, and a workplace that facilitates collaboration. That communication component is so important. Patient care units where teamwork is stronger had fewer reports and incidents of missed nursing care, leading to improved quality and safety of nursing care for their patients. So that collaboration, that communication is so important within the workplace, and it doesn't just happen. It requires nurses to facilitate that, to foster it, to develop it. And so that is so important when you're talking about building a team. And so when we look at that building the team, building an empowered nursing team begins with the nurse executive. It begins with that leader. If you are that leader, then it begins with you as that charge nurse or as that team leader. Now, the nurse executive is a clinical and business leader who is concerned with maximized quality of care and cost effectiveness while maintaining relationships and professional satisfaction of the staff. He or she establishes a philosophy for nursing that enables managers and staff to provide quality nursing care. And in box 21-2, characteristics of an effective leader. You'll find that also on page 280. It goes through the characteristics that that leader has. And the very first one is effective communicator. And the second one is consistent in managing conflict. None of us like conflict, but as a leader, you have to learn how to manage it effectively. Knowledgeable and competent in all aspects of delivering care, role model for staff, participatory approach to decision making. So somebody who takes into account everybody on the team and all of their opinions, and then once they've heard everybody out, then they consider everything in making their decisions. Shows appreciation for jobs well done, delegates work appropriately, sets objectives and guides staff, displays caring, understanding, and empathy for others, motivates and empowers others, is productive and flexible, focuses on team development. Those are all those things that we look for in an effective leader. Now, the nurse manager who uses transformational leadership is focused on change and innovation through team development, motivates and empowers staff to function at a high level of performance, and serves as a role model for the nurses on the unit. So when we talk about transformational leadership, what we're looking for is somebody who empowers their staff to go and work and do their jobs effectively. It increases levels of patient satisfaction, lowers patient mortality rate, lowers rate of medication errors. There's increased staff satisfaction, decreased stress and burnout in the nurses, decreased overall staff well-being, and increased staff retention. This transformational leadership, when we talk about transformational leadership, and that's what you see in magnet recognition, which is talked about in this chapter. Transformational leadership is about empowering your staff, and it focuses on change and innovation through team development, motivates and empowers staff to function at a higher level. What we're looking at is trying to encourage staff to do what they're supposed to do and follow regulations and critically think because it's the right thing to do, and appealing to their sense of value rather than saying, if you don't do what you're going to do, we're going to put you in the street, we're going to fire you. That's not transformational leadership. Transformational leadership would be appealing to why they became a nurse and their desire to really help patients. And this is how we help patients, and teaching and motivating in order to get nurses to do what they're supposed to do. And so that's what we would see in transformational leadership. A leader that uses motivation and trying to get to what the nurses really want. Say, the unit that has no falls for an entire quarter, we do a pizza party. That's a motivation rather than writing them all up and docking them. That wouldn't be motivational. So these are the things that we use to increase staff production. So in the teams approach, the nurse manager spends time on the unit with the staff sharing ideas, empowers the staff, is enthusiastic about seeking opportunities to enhance the team, shows appreciation and recognition of team members for a job well done, and it has to be sincere. I mean, it can't just be, oh yeah, you did a great job. It has to be really a sincere recognition of their work. Manages the team and holds the team members accountable. And it can't just be, you did it. It's, okay, you made a mistake. We've got to hold you accountable for it, but what can we do to keep it from happening again? It's holding them accountable by taking them through the process of, when you make a mistake, you are accountable to own up to it and mitigate the damage. What can we do to fix it and make sure it doesn't happen again? We have to do the whole process. And that's how we hold accountability without blame. And accountability is not blame. Blame implies that we're going to then discipline, and we don't want that. We want accountability, and then we fix it. And provide support in the stressful healthcare environment. That manager needs to be a support person for the staff. Somebody they can talk to, they can say, hey, look, I really got this problem. And then that manager helps them to figure out a way to deal with that problem. If you review box 21.3, which is also on page 280, it is evidence-based practice. nurses' work engagement. And it starts with a PICO question about, in hospitals, are nurses who are highly engaged in the work more likely to remain in nursing than nurses who have lower levels of work engagement? So it talks about that. And they find that work engagement is really important for nurses to not burn out. You have to be engaged. You have to be also able to have some time when you're not engaged. But highly engaged nurses had higher levels of personal initiative and making work engagement contagious. It's an important factor in delivering a safe patient care. So work engagement is really important for us in order to deliver our patient care. Excuse me. So magnet recognition. Now, magnet recognition is based on a five model component. And it looks at things like transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovation, and improvement, and empirical quality results. So a hospital that is magnet certified has a transformed culture with a practice environment that is dynamic, autonomous, collaborative, and positive for nurses. The culture focuses on concern for patients. Now, typically a magnet hospital has clinical promotion systems and research and evidence-based practice programs. The nurses have professional autonomy over their practice and control over the practice environment. Professional nurse councils at the organizational and unit level are one way to create an empowerment model. This culture and empowerment combine to produce a strong collaborative relationship among team members and improve patient quality outcomes. So we actually have at both the unit level and the organizational level, we have nurses organizations that meet and discuss how we can make our practice better, what needs to change. We actually collaborate to do things within that model, and the nurses actually have control of the practice. And it's very interesting that patient quality outcomes are often much, much better in magnet hospitals because nurses have control of the care. Now, the nursing care delivery methods, there are several different ways that we deliver care. And sometimes depending on the setting, the different methods work better in different settings. Now, there's a traditional method, traditional models that we have. One of them is team nursing, where you have, in team nursing, the registered nurse is a leader who leads a team of other RNs. You have the registered nurse or charge nurse is that leader. And then you have other RNs, practical nurses, nursing assistants, or CNAs who provide direct care to patients. And so that's our team nursing. Now, primary nursing supports a philosophy regarding nurse and patient relationship. It's typically not practiced today because of the high cost of an all-RN staffing model. But actually, a lot of the hospitals around here are going back to primary nursing, and they'll have like a pod of like 3 or 4 rooms, and one nurse has that pod, and it's usually one nurse and a tech, or one nurse and 2 techs, depending on the acuity of those patients. And so that one nurse has those 3 or 4 patients, and that's their patients. And each nurse has a pod. And then you have a unit manager or a unit supervisor, or whatever their title is, who's in charge of the floor or the unit. And so that's a lot of the hospitals around here have gone to this, back to the primary nursing model from the team model. And so one of my students from my other class was telling me that their unit was just switched over to a COVID patient unit. They had said they were going to dedicate 7 beds, and they're already at capacity at 14 beds. They're a 14-bed unit, and they already have 14 COVID patients. So they are already planning to put beds in the hallway to increase their capacity to almost double what they usually have, which would put them at 28 patients. So they're not going to be able to stick to their primary nursing model, and so they're going to have to go to a team nursing model in order to accommodate all these patients. And so they're having to switch their focus, their way of thinking, to a team model, and it's difficult for them because in your primary model, the nurses, they just take care of their patients and that's it. And now they're going to have to work as a team and do team nursing, and it's very different for them. So now when we get to today's models with patient-centered care, total patient care, and case management, we'll talk about those on the next slide. We got patient and family-centered, which this is a care model of nursing in which mutual partnerships among the patient, family, and healthcare team are formed to plan, implement, and evaluate the nursing and healthcare delivery. At the center of patient-centered care is the patient or family member as a source of control and full partner in providing care. And of course, these core concepts are respect and dignity, information sharing, participation, and collaboration. Now, the problem is, right now, family members cannot be in the hospital. They cannot be at the bedside. We might be talking to them by Zoom or Skype, but information sharing is limited. We're in a hurry, and they're not right there where we can just jump in and talk to them. So they have been taken out of the equation. And I posted a article to your Blackboard, which is an article about taking that component out of our healthcare team, that family member who often is the one that gives us a lot of information, shares information with us, particularly when that patient is very sick. If they're on a ventilator, that patient can't give us information or make decisions sometimes for us. And so that family member is not there. We can't have them there. And so that actually changes this dynamic for us. So that makes it very different for this care model. So that's kind of difficult for us to deal with when we're dealing with this patient model. Now, when we look at our case study here, and Jennifer, who's a nursing student, and she has Mrs. Sinclair scheduled for surgery, Mr. Timmons finished lunch and is ready for pain medicine, and Mr. Dodson, who has a post-operative wound infection and is due for antibiotic medication. Those are our people. Now, if you were Jennifer, which patient would be first on your priority? What do you think? Think about that. You've got your scheduled patient for surgery. You got your patient who's just finished lunch and they need pain medicine, and then you've got your patient who's got antibiotic medication. So what factors would you consider in? Who would be first that you would want to go and take care of? Just think about it. So now back to our care models. So we have the next one, which is our one. So total patient care, We have a registered nurse who works directly with patients, family, and the healthcare team members. And the RN is responsible for patients during the shift of care, although care can be delegated. They're working with a care tech or an LPN. Approach may not be cost effective owing to the high number of RNs that are needed, but patient satisfaction is very high. And in total patient care, it emphasizes a high degree of collaboration with other healthcare professionals. And total patient care is when the RN is responsible for all the aspects of the care for one or more patients during a shift of care. Like I said, a lot of hospitals, it's pods, and they have, usually it's anywhere from 1 to 2, if you're talking about a ICU situation, to 3 to 4 patients. And they're also dealing with not only the patient, but the family and other health team members when they're doing this. Now, patients are very happy with this because you have one nurse, they only have a very low number of patients, so they're very happy about that. But it's also not as cost effective for hospitals because they need a high number of RNs. Now, case management is a collaborative process of assessing, planning, facilitating, and advocating for options and services to meet an individual's healthcare needs. It's a care management approach that coordinates and links healthcare services to patients and their families while streamlining costs and maintaining quality. A clinician oversees the management of patients with specific complex health problems and are usually held accountable for some standard of cost management and quality. Communication and use of available resources promote quality, cost-effective outcomes in this model. Often the case manager is an advanced practice nurse who helps improve patient outcomes via specific interventions. The case management model emphasizes supervision, not necessarily providing direct care, but overseeing the care delivered by other staff and healthcare professionals. A lot of times we see the case management model for people with chronic or long-term illnesses. A lot of times you see it out in the community. A lot of times for mental health patients who have long-term illnesses, patients that have things like diabetes, heart disease, things that are going to keep them in and out of healthcare, potentially in and out of inpatient care for a long period of time. And we don't want every time they go in to have to go back to square one. And so case management is able to facilitate that. And so that's why case management can be very effective for patients who have chronic long-term illness. And it can really be cost effective because we don't have to go back and redo everything every single time because they've already had it done. And so we can just say, hey, you had that done, we don't need to go back. And so they do that. Now, decision making. Decentralized management means that decision making occurs at the level of staff. And so it encompasses responsibility, duties, and activities an individual is employed to perform. Autonomy, which is independent decisions about patient care. Authority, legitimate power to give commands and make final decisions specific to a given position. And accountability, answerable for those actions. Now, decision-making is a critical component of an effective leader and manager. And that's really important. Decentralization is a component of the hierarchical level of decision-making found in healthcare institutions. Decentralization means that you have a unit manager who's responsible for that unit. It doesn't all have to go back to the head of the hospital. That unit manager is responsible for making certain decisions within their unit. Then there are certain things that they can't make decisions about that do have to go up higher than them, but they have certain things they are autonomous about within their unit. And so you have decentralized decision-making where at each level there are certain things they have autonomy to make independent decisions about concerning the care of their patients, the running of their unit, how things are going to go within their unit. And so it's really important because there are some things about day-to-day running of the unit and care of patients that they have to make those decisions right now. We can't wait 3 weeks while it goes up to the president and sits on his desk. And we can't do that. We have to make those decisions right now. Mr. Jones needs to be able to have that, whatever it is, right now, not in 3 weeks. So what happens is it's the manager who directs and supports decision-making, and it's an important tool for nurses. If you look at box 21.4, which is on page 282, responsibilities of a nurse manager, it goes through all of the things that nurse managers can do, such as recruiting new employees, with interviewing and hiring, monitoring professional nurse standards of practice. We have guidelines. We have things that guide us in our decision-making, but we have some autonomy when you're a nurse manager to do those things, make those decisions on your own. Establish, monitor, and implement unit performance quality improvement plans, view and recommend new equipment for the unit, conduct regular staff meetings, doing things to find out where are we having issues and problems, and then coming up with that plan for improvement. Those are things that we do autonomously because we know we're supposed to. Working in a decentralized structure has the potential for greater collaborative effort, increased competency of staff, increased staff motivation, and ultimately a greater sense of professional accomplishment and satisfaction. We have the autonomy to make our unit better. We have the autonomy to make sure that we are doing the best job we can do. Unfortunately, sometimes what happens is if we have the autonomy, it means that if nobody's watching, things can devolve very quickly. And if we aren't stepping up to our responsibility, that's when things can go very badly. And it's our responsibility to keep an eye on it. The responsibility reflects ownership. An individual who manages employees has to distribute responsibility. And the employees have to accept the manager's direction. Managers have to be sure that staff clearly understand their responsibilities, particularly in the face of change. Right now, we are in the face of tremendous change, and a good manager gets their employees to accept ownership within their unit of, at the end of the day, we don't have enough PPE. It doesn't matter whose fault it is. Right now, we don't. What can we do about it? How do we go back and figure out how to get ourselves protected? How do we come up with a plan to protect ourselves with what we have? How do we get other? How do we come up with ownership within this to protect everybody? And that's how we buy in. It doesn't matter whose fault it is. It just matters that we fix the problem. And an individual manager can do this. They have to be sure that staff understand we're in this together. Our autonomy has to be consistent with the scope of professional nursing practice and maximizes the nurse's effectiveness. In work autonomy, a nurse makes independent decisions about the work of the unit, such as scheduling or unit governance. Autonomy is not absolute. It occurs in degrees. So we only have autonomy within our lane. We have autonomy within certain things. We can't just do anything we want. We have to still follow the rules and regulations of our profession. We are autonomous within our scope of practice. We are autonomous within the rules that we know govern us. And with authority, the nurse is able to choose and recommend appropriate teaching strategies for the patient on behalf of other healthcare team members. The nurse has the final authority in selecting the best course of action for the patient's care. Accountability means that as a nurse, you are responsible for providing excellent patient care by following standards of practice and institutional policies and procedures. You assume responsibility for the outcome of the actions, judgments, and omissions in providing that care. So accountability means you are answerable for your actions. You must have a rationale that says, I followed all of these policies, procedures, institutional policies, standards of practice for my profession, and here is where I got it from. If you cannot be answerable for why you did what you did, you could be liable. Because you have to be following good policy, procedure, and standards of practice. Always. Heavy stuff. Heavy stuff. So, quick quiz. I'm going to do a quick quiz here. A travel nurse has taken an assignment at a healthcare facility where nurses assume responsibility for a caseload of patients over a period of time. This type of nursing exemplifies what? Is it team nursing, primary nursing, functional nursing, or decentralized management? Do you think for a minute? Think. Okay. If you want to think some more, stop this now. Otherwise, I'm going to tell you. It is B. And the rationale for that is the primary nursing model of care delivery was developed to place RNs at the bedside and improve accountability of nursing for patient outcomes and the professional relationship among staff members. Primary nursing supports a philosophy regarding nurse and patient relationship. So if the nurse assumes a caseload of patients over a period of time. So they've got a caseload of certain patients, that's primary nursing. If they were all working together with nurses, with all of the patients, that would be team nursing. I don't know what functional nursing is, and it's not anything like decentralized management. Okay, on to the next. So now we're going to talk some more about decision making. So decision making, staff involvement is really important in decision making. Now, as a leader, remember we said in transformational leadership and decentralized decision making exists on a nursing unit. All the staff members actively participate in unit activities. So we want all of the staff to be involved. Now, of course, the leader makes the decision, but it's about talking to the staff and getting their input, gathering information. We always have our patients make informed decisions. We give them all the information. We tell them what the benefits and the risks are of every surgery. Well, we should be doing that as leaders too. And in transformational leadership, that's very important. The use of the use of transformational leadership practices positively impacts the work environment, resulting in greater nurse empowerment, improved culture and climate, increased nurses' research utilization, and better teamwork between nurses and physicians, greater role clarity, and reduced conflict and ambiguity. When we're using transformational leadership and we're taking everybody's input into account, we're not making decisions and being blindsided by information we didn't know. And everybody feels as if they had input into that decision. So they're all feeling as if they've been empowered because they were heard. And so there's more teamwork there, and we can connect everyone. And it's called shared governance, where we're all having a part in this shared governance. And shared governance, if you look on page 283, it talks about shared governance. And usually that is it's chaired by senior clinical staff nurses, and these groups establish and maintain care standards for nurse practice on their unit. Shared governance is a dynamic process that promotes decision-making, accountability, and empowerment in staff nurses and enables them to control their nursing practice. Participation in shared governance empowers a nurse to make decisions and increase nurses' confidence in decision-making and their autonomy. Now, this allows nurses, using shared governance in these councils, it allows nurses to set the standards and say, we need to have a higher standard of infection control. We need to have a higher standard of fall prevention. Because we as nurses see it, and it actually allows the staff to set the standard, to be accountable. It's not just the unit manager responsible for all that, it's all the nurses. And it works really well. Interprofessional collaboration among nurses and healthcare providers. Making sure that we're getting together with our other members of the healthcare team to see how we can better improve our working together with other healthcare providers. Interprofessional rounds, staff communication. How can we improve it? Staff education. And all of these communications help us to make better decisions. And then as a nurse manager, the nurse manager supports staff through establishing nursing practice through problem-solving committees and professional shared governance councils, which we just talked about, interprofessional collaboration among nursing and healthcare providers, and that's what I just talked about, interprofessional rounding, staff communication, staff education. Nursing practice is established through problem-solving committees, professional shared governance, and is chaired by senior clinical staff nurses. And I just read all about that. Shared governance, interprofessional collaboration among nurses and healthcare providers is critical to delivering quality and safe patient care and the creation of a positive work culture for practitioners. Interprofessional collaboration involves all professions bringing different points of view to the table to identify, clarify, and solve complex patient problems together, providing integrated and cohesive patient care. Competencies needed for effective interpersonal collaboration are: work with individuals of other professions to maintain a climate of mutual respect and shared values. No more saying, that doctor, I can't believe what he did. We should be professional about others of other professions. We can't be running them down. We have to be professional. Use the knowledge of one's own role and those of other professions to appropriately assess and address the healthcare needs of patients and populations served. We have to look at, could they benefit from physical therapy? Let's do a consult. Could they benefit from speech therapy? We consult with them. We really need to address those healthcare needs and see what we can do to collaborate. Communication with patients, families, communities, and other healthcare professionals is a responsive and responsible manner that support patient-centered care and a team approach to the maintenance of health and treatment of disease. So these are competencies that we really need to have. During rounding, members of the team meet and share patient information, answer questions asked by other team members, discuss patients' clinical progress, and plan for discharge. Focus all team members on the same patient goal. This decreases medical errors, decrease patient readmission rates, impact patient satisfaction, and improve quality of care. A manager's greatest challenge, especially if a work group is large, is communication with staff. Communication is always a huge challenge. An effective manager uses a variety of approaches to communicate quickly and accurately to all staff through newsletters, minutes of meetings accessible, and conducting staff meetings. I guess everybody is starting to conduct staff meetings via Zoom, Skype, and everything else now. A professional nursing staff needs to always grow in knowledge. It is impossible to remain knowledgeable about current medical and nursing practice trends without ongoing education. We are lifelong learners. Staff education should be constant. And the manager should find ways to make it easy, accessible for their staff, and hopefully not onerous where they're like, I had to do that. It should be stuff that they really want to know, information that really enhances their work, that they really want to get. So the manager should really be trying to find ways to impart knowledge that the staff is interested in, and that helps their job. So, leadership skills for nursing students. It's important that as a nursing student, you prepare yourself for leadership roles. Learn to become a leader by consulting with instructors and nursing staff to obtain feedback and maintaining good clinical decisions. Learning from mistakes and seeking guidance, working closely with professional nurses, and trying to improve your performance during each patient interaction. These skills require you to think critically and solve problems in the clinical setting. Thinking critically allows nurses to provide high-quality care, meet the needs of patients while considering their preferences, consider alternatives to problems, understand the rationale for performing nursing interventions, and evaluate the effectiveness of interventions. Important leadership skills to learn include clinical care coordination, team communication, delegation, and knowledge building. So these are your leadership skills. And you guys will start out at the lower levels, and then you will move up in your leadership skills as you become more experienced. So clinical care coordination. Clinical care coordination includes clinical decision-making, priority setting, use of organizational skills and resources, time management, and evaluation. The activities of clinical care coordination require use of critical reflection, critical reasoning, and clinical judgment. They are important first steps in developing a care relationship with a patient. Use of critical thinking approaches, applying previous knowledge and experience to the decision-making process. Clinical decisions. Your ability to make clinical decisions depends on application of the nursing process. Knowing the patient involves more than gathering formal assessment data. It requires learning a patient's typical patterns of response in his or her current situation and knowing the patient as an individual. If you do not make accurate clinical decisions about a patient, undesirable outcomes will probably occur. The patient's condition worsens or remains the same when you lose the potential for improvement. Never hesitate to ask for assistance when a patient's condition changes. So, during clinical decisions, you want to apply your nursing process, know your patient, and then use your clinical decision-making practice. Priority setting. After forming a picture of the patient's total needs, you set priorities by deciding which patient needs or problems need attention first. Classifying patient problems in 3 priority levels: high priority, an immediate threat to the patient's survival or safety; immediate priority, non-emergency, non-life-threatening, actual or potential needs that the patient and family members are experiencing; or low priority, actual or potential problems that are not directly related to a patient's illness or disease. Many patients have all 3 types of priorities, requiring you to make careful judgments in choosing a course of action. Obviously, high priority needs demand immediate attention. To identify which patients require assessment first, rely on information from the change of shift report, your own most recent assessment of the patient, and information from the medical record. And of course, we look at Maslow as to prioritize as well. So here we are back to our case study. Mrs. St. Clair's surgery is scheduled for 1 p.m. She has never had surgery before and is very nervous and moving restlessly in the bed. She is reluctant to talk, but her preoperative checklist is not yet complete and she needs to be escorted to surgery in 30 minutes. So there's a little more information. After reading the details about Mrs. St. Clair, do you have enough information to know which patient Jennifer should attend to first? So, we don't know about the other ones yet. So, you only have 30 minutes to complete her checklist. So maybe we needed more information. We'll wait until we have a little more information. So let's go on to the next one. Okay, so here's Mr. Timmons. Had abdominal surgery 2 days ago for colon tumor removal. He has finished his lunch, is ready for pain medication. He is preparing to get out of bed to walk down the hall. So, and he needs his pain medication. Okay, so with this information, would you make the same decision about the patient's first needs Jennifer's attention? So he's getting ready. He said 2 days ago he had colon tumor removal. Now he's getting ready to walk down the hall, needs his pain medication. And you got the other lady, 30 minutes, you got to get her out to surgery. So, let's see what the next one says. So, next one is, Mr. Dodson has a post-operative wound infection. His wet to dry abdominal dressing needs to be changed, and he needs his next dose of antibiotic. So, the 3 patients assigned, which patient should Jennifer help first? So what do you think? So let's see. So Jennifer stays with Mrs. St. Clair to assess her new symptoms and complete her preoperative checklist. She sends a unit clerk to check on Mr. Timmons. Once Mrs. St. Clair's checklist is complete, she stops by Mr. Timmons' room to assess his pain and administers pain medication. She then verifies Mr. Dodson's identification and administers the antibiotic, and next completes the dressing change. In this order of priority, is this the order of priority you would have used? Think about it. So, organizational skills. Implementing a plan of care requires you to be effective and efficient. Effective use of time means doing the right things, whereas efficient use of time means doing things right. A well-organized nurse approaches any planned procedure by having all of the necessary equipment available and making sure that the patient is prepared. If the patient is comfortable and well-informed, the likelihood that the procedure will go smoothly increases. That makes sense, right? Get all your stuff together, tell the patient what you're going to do, make sure everything is ready. Then use of resources. Appropriate use of resources is an important aspect of clinical care coordination. Resources in this case include members of the healthcare team. Never hesitate to have staff help you, especially when there is an opportunity to make a procedure or activity more comfortable and safer for the patient. Consulting with an experienced RN confirms findings and ensures that you take the proper course of action for the patient. A leader knows his or her limitations and seeks professional colleagues for guidance and support. That's really important to remember. As a new RN, you have to remember that sometimes you got to ask. We all had to ask. And anybody who looks down on you for asking just doesn't remember back when they were a new RN. Because we should not expect you to come out of school knowing everything. And it's important that you ask and get help from your peers. Time management. Now, time management can be hard for a lot of us. One useful time management skill involves making a priority to-do list. Good time management also involves setting goals to help you complete one task before starting another. Time management requires the ability to anticipate the activities of the day and combine activities when possible. In box 21-5, on page 286, there are principles of time management that you will find useful. There are things like goal setting, time analysis, priority setting, interruption control, which is a big one. In fact, a lot of places when you're giving medications, they have signs that you put on your cart and even on the nurse that says, "Do not talk to me, I'm doing medications." Because interruption control is one of the things we have found that cause errors. And so interruption control is a really, really big thing to keep you on target. And then evaluating how it went and how you could make it better. So that's a really big important thing for time management. Oops. So evaluation. When we do evaluation is ongoing, just like other steps of the nursing process. Once you assess a patient's needs and begin therapies directed at a specific problem area, immediately evaluate whether therapies are effective and the patient's response. When expected outcomes are not met, evaluation reveals the need to continue current therapies for a longer period, revise approaches to care, or introduce new therapies. Keeping a focus on evaluation of the patient's progress lessens the chance of becoming distracted by the tasks of care. So now here we are back at our case study. When Jennifer assesses Mr. Timmons' pain, she discovers that his pain is still 8 out of 10 following Percodan 20 milligrams every 6 hours. Patient-controlled anesthesia PCA with morphine was removed 4 hours ago. She determines that his current pain medication is insufficient to control his pain and requests a change in his medication. So the evaluation of a process often leads to new interventions. So as part of a nursing team, you're responsible for using open professional communication. Strategies you can use to improve your communication with physicians include addressing the physician by name, having the patient and the chart available when discussing the patient's issues, focusing on patient problems, and being professional and not aggressive. Part of good communication is clarifying what others are saying and building on the merits of coworkers' ideas. Sharing expectations of what, when, and how to communicate is a step toward establishing a strong team. Examples of communication tools that improve communications include briefings or short discussions among team members, group rounds on patients, call out to share critical information such as vital signs with all team members at the same time, checkbacks to restate what a person has said to verify understandings of information. So that's really important with orders, and all night shift people know that anytime you get orders from a doctor over the telephone at night, you always read back and have them confirm. So checkbacks, really, really, really important because you have to make sure that they confirm that that's what they actually told you. The 2-challenge rule that allows concerns to be voiced twice, which allows all team members to voice concerns about safety. The cuss words, which means I'm concerned, I'm uncomfortable, I don't feel this is safe. The use of Situation Background Assessment Recommendations, SBAR, when sharing information. Filling out the SBAR form with all of the information you need before you get the doctor on the phone, so that you have all of that information, all that assessment right there, and you can give all that information to that physician on the phone, so that that's all communicated, and then you can fill in on that. Okay, they want this, this, and this done, or these orders, so that it's all communicated right there. That tool is just such a great tool to use, because it allows you to communicate so effortlessly with that provider. Now, delegation. Delegation is really important. As a nurse, you must delegate, and it's important to understand how you delegate. The Nurse Practice Act of Virginia, and it's different in each state, so you have to make sure you know whichever state you're going to be licensed in what their Nurse Practice Act says. Along with principles of authority, accountability, and responsibility is the basis for effective delegation. Delegation is an essential part of management. Never delegate a task that you dislike doing or would not do yourself, because this creates negative feelings and poor working relationships. So don't always say, I hate doing that, I'm just going to delegate it. Don't always give somebody the dirty work. But make sure that you're always willing, to do it if you have to do it, to get in there with them. And sometimes you even have to just get in there with them and do it, to make sure that you show that you're willing to do this. You delegate because there are other things that you as the RN must do that you cannot delegate. And that makes sure that you don't create negative feelings with delegation. As a nurse, you're responsible and accountable for providing care to patients and delegating care activities to the nursing assistant personnel. However, you do not delegate the steps of the nursing process of assessment, diagnosis, planning, and evaluation, because these require nursing judgment. Patient teaching is also the responsibility of an RN and should not be delegated. As an RN, you are always responsible for the assessment of the patient's ongoing status, but if a patient is stable, you delegate vital sign monitoring to nursing assistant personnel. Appropriate delegation begins with knowing which skills you are able to delegate. Know your state's Nurse Practice Act. As a professional nurse, you cannot simply assign the nurse assistant personnel tasks without considering the implications, assess the patient, and determine a plan of care before identifying which tasks someone else is able to perform. Efficient delegation requires constant communication. When you delegate, you are responsible to tell the person you delegate what you want them to do and how you want them to do it. If you don't tell them that, then however they do it, you must find acceptable. So you must tell that assistant personnel, I want you to walk this patient, and I want you to walk them from the nurse's station down to the end of the hall and back with a 2-person assist and a gate bell. If you don't tell them that, and they just get the person up from the bed and walk them to the bathroom and walk them back, you didn't tell them any different. And a lot of times nurses will say, I want you to walk the patient. And then when they don't do it the way the nurse had in her mind, the nurse gets mad at them. Why did you do it that way? Because that's the way I thought you wanted it done. Because you didn't tell. So it's very important that when you delegate, you communicate clearly your expectations of the task. It's really, really important. When Jennifer was able to delegate one of her tasks for the patient, while she was caring for another patient, she really had to be specific about what she told that person. And that was something that, she should have been very clear in her telling that patient, telling that staff about that patient if she wanted it done correctly. So In delegation, there are 5 rights of delegation. And they are the right task, the right circumstance, the right person, the right direction, and the right supervision. So the right task is one that can be delegated for a specific patient, such as tasks that are repetitive, require little supervision, are relatively non-invasive, have results that are predictable, and have potential minimal risk. Appropriate patient settings, available resources, and other relative factors are considered in determining the right circumstances. The right person is delegating the right task to the right person to be performed on the right person. If you're going to delegate, you can't delegate giving medications to a CNA. But you might be able to delegate giving medications to an LPN because they are able to give medications. So if you have an LPN who's serving as your medications nurse today, then you could delegate giving medications. So you have to make sure that the right person you're using to delegate those tasks. They have to be able to do that within their scope of practice. You can't delegate to a person who isn't able to do those tasks. So it has to be the right person. The right direction communication indicates that a clear, concise description of the task, including its objective, limits, and expectations, is given. And then the right supervision evaluation means that appropriate monitoring, evaluation, intervention as needed, and feedback are provided. Just because you delegate it doesn't mean you just forget it. You have to be monitoring that person and paying attention to what's going on and the outcome. Now, on page 287, there is a box 21-6, which has the 5 rights of delegation within it. So you can look at those. Now, the steps to effective delegation: providing clear instructions and desired outcomes when delegating tasks. These instructions initially focus on the procedure itself, what will be accomplished, when it should be completed, and the unique needs of the patient. Important steps in delegation are evaluation of the staff member's performance, achievement of the patient's outcomes, the communication process used, and any problems or concerns that occur. As an RN, you may be delegating tasks to nursing assistant personnel. To assess knowledge and skills, ask open-ended questions that elicit conversation and details about what he or she knows. You will need to know which tasks and skills within the scope of practice and job descriptions for team members to whom you delegate. So make sure that you know it's within their scope of practice. Always provide clear directions by describing a task, the desired outcome, and the time period within which nursing assistant personnel should complete the task. If you need it done by a certain time, you have to communicate that. Listen to the response of nursing assistant personnel after you provide directions. Help sort out priorities if needed. Always give assistant personnel feedback regarding performance regardless of the outcome. And make sure that if the outcome is less than optimal, make sure that you try to keep your feedback constructive so that the outcome can be better next time. You need to always maintain a constructive attitude and try to help guide them so that it can be better. You don't want to be punitive. So here's another quick quiz. We've got a newly graduated nurse is assigned to care for a team consisting of herself and a certified nursing assistant. When delegating skills, she needs to assign only bed making and feeding to this nursing assistant, assess the knowledge of the certified nursing assistant, remind the staff member that she is working under a licensed RN, or allow the staff member to perform only skills that the RN is able to teach certified nursing assistants to perform. If you want to think about it more, stop this now. Otherwise, we'll go on with the answer, and the answer is B. And the rationale, the reason for ascertaining the nursing assistant's knowledge and skills is because the nurse does not want to delegate tasks that the assistant may not be able to do, thus putting the patient care in jeopardy. If you were going to assign her to do bed making and feeding, you have to make sure that she's been taught that she knows it, that she knows what to look for if she were going to feed that patient. So you would want to assess her knowledge before you would actually even assign her to bed making or feeding. You're going to make sure she learned it. She's supposed to know it, but does she? Does she know what she's looking for when she's feeding that patient? Does she understand how to make sure that patient doesn't choke? You have to make sure she understands all of that. So you would have to assess that. So knowledge building, when we're doing knowledge building, we want to remain competent. Remaining competent provides the foundation for further skill building. Lifelong learning allows you to continuously provide safe, effective, and quality care. So you're going to be a lifelong learner. You better get used to this school thing right now. In-service programs, workshops, professional conferences, professional reading, and collegiate courses offer innovative and current information on the rapidly changing world of healthcare. Ongoing development of skills in delegation, communication, and teamwork help maintain and build competency. So constantly bettering yourself and bettering your skills. It's really important. And that is the end. So if you have any questions, you can bring them into discussion and we will talk about them. Thank you and have a good week.